This virus comes around every year, usually in late fall. So it's kind of early for us to be seeing it, which concerns everyone. Like, is this the ramp up? Are we on the way up to a much higher peak? Right now, we're managing. It is straining the system, no doubt, and these are huge numbers we're seeing. But we're managing, and if this is just the beginning, then that's the concern.
Orange County in Southern California has declared a health emergency amid a surge in cases of respiratory syncytial virus, or RSV, that are reportedly filling some hospitals to capacity. RSV is not a new virus, but it is a leading cause of pneumonia in toddlers and the elderly and can lead to hospitalization, or in rare cases, death. Dr. Jim Keeney is the co-director of the emergency department at Providence Mission Hospital in Mission Viejo, south of Los Angeles.
RSV is different depending on your age group. So, older kids, adults, they may get just laryngitis or a scratchy throat, real minimal symptoms, sometimes a cough. It's the younger children that typically are more impacted. Their tiny little airways can get plugged with the mucus that's created by the infection, and then they need assistance to breathe. And that's what we're seeing. We're seeing the younger kids requiring oxygen, requiring admission to the hospital, and then what we call pulmonary therapy to kind of loosen up all that mucus and try and get it out.
One reason RSV is raising alarms this year is timing. Climbing cases coincide with an earlier than expected flu season and rising rates of COVID 19 transmission. Together, that can put a dangerous strain on the nation's healthcare system.
Well, I think what was brought to the forefront with COVID is how delicate our healthcare system is. It's not really built for these large surges and to be able to especially maintain them over long periods of time. So we need to do what we can as a community to reduce the spread of illness. Stay at home when you're sick, cover your mouth when you're in public and coughing, sneezing, maybe wear a mask, wash your hands more frequently. There is no vaccine for RSV. So people do need to understand that we can't really prevent it beyond those infection prevention measures of not exposing people.
But a vaccine could be on the horizon. Drug maker Pfizer said this week its experimental RSV vaccine was found effective for preventing severe infections in infants after being given to expectant mothers in the second half of pregnancy. Pfizer's shot, if approved, could be the first maternal vaccine available to relieve the burden of the disease in young infants. The company stopped the trial after the early success and plans to file for approval by the end of the year.